is. I'm Wendy Sansom. I'm from Box Hill Hospital in Melbourne, and I've worked at Box Hill Hospital for 37 years. And I've been doing stomal therapy since about 1984. Things have changed a lot over that period of time because everything happens so much quicker now than it used to. I know we used to bring patients in 3 days beforehand and prepare them, but everything's done very quickly now. I think the challenge, it's very interesting, I think the challenge for patients is often related to their diagnosis as well. So I think depending on what the diagnosis and the acceptance of having a stoma is very important and will impact significantly on how well they receive that and how well they get on with their life afterwards. So I do have the fortunate position where I do see patients often at their time of diagnosis, and then again in the pre-admission clinic, and depending on their levels of anxiety or understanding, I can see them again. So I think that's a real bonus to have that opportunity to see them on numerous occasions before the surgery. I think once the patient has got their head around the diagnosis, particularly if it's a cancer diagnosis, they're dealing with the cancer as well as this very body-changing surgery and how that's going to impact upon their life. But I do see patients also that have it for other reasons, where they can see that having a stoma is a positive thing and can certainly improve their quality of life. We've just listened to a presentation at the conference from a young fellow who has had a stoma, and he actually wrote the 10 things that he hated about having a stoma and the 10 things he loved having about a stoma, and the 10 things he loved having about a stoma certainly outruled the other ones. It was just amazing how it's changed his life. So I think that, again, depending on the person's acceptance, their diagnosis, the supports that they have got to go home with, and if they're in a care facility, obviously you're going to have to include those people and offer them the opportunity to be involved in discussions for managing it. Having really good information to give patients and their family, carers, whoever, pre-operatively is really important, because people do go to the internet, and the information they get there is, as we know, of variable qualities, but often people will look up the wrong sort of stoma that they're going to have. We may know they're going to have an ostomy and have a drainable bag, but they will come in and say, but I've seen I can have this closed bag. So I think the benefits of pre-operative information, handing out that information, as well as being able to eyeball the person and have that face-to-face contact, is really important in how they're going to manage post-operatively. It's interesting because people sometimes that you don't anticipate will have challenges post-op. You know, they've come in very positive. It's very different seeing that thing on your tummy to actually looking at it in a book or a picture or online. And you do find a lot of people do go online now, and a lot of people do not have that textbook stoma. It's very interesting. And again, that comes back to the challenges we face now with age, increasing age. People have different comorbidities, limited mobility, all those sorts of things. They're not as dexterous, their understanding may not be as good, and so lots of people, and they may be dependent on someone helping them care for it. Again, as we've previously mentioned, obesity adds to this problem as well, because people don't get that textbook stoma. So we give them information that has this lovely little cherry, little rosebud, and theirs absolutely doesn't look anything like that. So that can be a challenge to people. That doesn't look like I thought it was going to look like, or not what you explained to me. I think another very important thing is that there are so many products out there on the market now too, to make sure that the staff are familiar with that product that you've chosen for that particular person based on their needs and their clinical assessment. Something as simple as the tail closure of the bag. They vary from company to company, so it's really important that the staff know how to close that properly, because you can imagine if they don't get it right, it's pretty devastating.